Okay, so we are live almost. So we'll start in another 1 minute. Phones on silent, please. So I'm starting now, ma'am. Good evening, everyone. I, Mohammad Afan Ansari, warmly welcomes you on behalf of Metro Group of Hospital. Today, we'll talk about taking care of dental and oral hygiene. And to address this session, we have Dr. Sonia Khorana, Senior Consultant, Dental Surgeon, Oral Pathology, Microbiology, and Oncology, Metro Multi-Speciality Hospital, Sector 11, Noida. Dr. Sonia has an experience of more than 2 decades in dentistry and oral oncology. After her experience in one of the top hospitals in Delhi, she evolved the dental department at Metro Hospital Noida into a state-of-the-art multi-chair, highly specialized dental center. Practicing here since 2002, Dr. Sonia Rana has grown to become one of the most prominent dentists in the region. She has a vast experience in cosmetic dentistry, repair of broken teeth, bad breath elimination, RCTs, and dentures. She has also started school dental health awareness program in prominent schools of Noida. Her areas of clinical interest are cosmetic dentistry, oral mucous membrane disease, oral pathology, oral oncology. And as far as her education is concerned, she did BDS, that is Bachelor's of Dental Science from University of Pune, and MDS in Oral Pathology, Microbiology, and Oral Oncology from Pandit B.B. Sharma University of Health Science, Rohtak. She is a proud member of Indian Dental Association, Indian Academy of Restorative Dentistry, Indian Academy of Aesthetic and Cosmetic Dentistry. So, hello, ma'am.
Hello, hi, everyone.
My first question to you is: are sweets and ice bad for our teeth?
Good afternoon, everyone. It's a great platform to share knowledge about dental health, which is very important. And taking up the first question, whether sweets or ice is good or bad for teeth. Yes, it's very relevant. We must know, and it's a very commonly asked question. Sweets are not actually sweets are bad for teeth, but yes, if they remain stuck on teeth, they can be very, very harmful in a sense that they can serve as a food for bacteria and which can end up the teeth can get decayed because of that. So we should have sweets, but make sure that the sweets are taken not frequently, and you must brush after taking the sweets. Should not remain on your teeth. And ice is not harmful, but yes, any hard food, if it is bitten by a brittle tooth, it can fracture the tooth. So we see kids though biting ice cubes. Yes, ice cubes should be used for drinks, not to chew on them.
Oh, thank you. And moving on to our next question: how often should one get a dental checkup done?
We should be very regular with our dental checkups. We generally tend to neglect teeth or have this kind of impression that we must visit dentist only when we have a dental issue, active dental problem or a symptom. But no, we must visit our dentist regularly, 6 months to 1 year. That means annual dental health checkup is a must to maintain good teeth for a lifetime. Uh, Sorry, Afan, I can't hear you. There is
Sorry,
some,
ma'am.
yeah.
Yeah, so thank you. And moving on to next question. How dental x-rays plays an important role in dental treatment?
Dental X-rays, any other X-ray, has is a backbone of diagnosis of any dental problem. We come to a conclusion with the help of dental X-ray, which is very easy to do or chairside. So they do carry a lot of importance as in diagnosis, and also digital X-rays with the ease of doing the digital X-rays and the high resolution, they are very important for a successful dental treatment procedure, especially like an RCT or a dental implant. They do assist the dentist while the procedure as well. So they are vital in the dental treatments. Unmute yourself. Uh,
Sorry again. Yeah, so what are the best ways to practice good oral hygiene at home?
Most importantly, brush regularly, at least twice in a day, and especially bedtime. Nowadays, since people work in shifts, night, days, same, so I would say before bedtime, brushing is mandatory. The regular mouthwash and floss regularly. Eat a healthy, balanced diet, and as we already discussed, not sweet, sticky food frequently.
Okay, thank you. Ma'am, next question is, what is tooth sensitivity and why don't one have it?
That's something I think everyone wants to know. What is tooth sensitivity? Sensitivity is something an abnormal sensation which is caused in our teeth due to any hot or cold temperature food. It is an abnormal sensation because when our teeth are absolutely normal, we do not get sensitivity to an ice cream or a sweet. We very commonly hear. So whenever we are having any abnormal sensation on eating any temperature food, may sometimes even a room temperature liquid does give us a sensitivity. That means there is some sort of abnormality related to our tooth. Maybe a superficial one in the enamel or in the dentine in the innermost layer, maybe a crack or a decay or some gum disease that causes tooth sensitivity. And depending upon the causative factor, the severity of sensitivity varies. It can be mild, it can be momentary, or it can be a chronic thing, or a long term thing can end up having a lot of pain. So we should never ignore tooth sensitivity. Whenever we do have, please visit your dentist, consult your dentist definitely.
Okay, so next question is, when should I consider dental implants?
uh, um, you're asking about dental implants. The
Yeah, so what is
dental
the right time to consider or to go for dental implant?
Oh, the right time is whenever you want to replace your missing tooth. It's the ideal treatment procedure to replace any missing tooth at any age. And these are basically artificial teeth which are fixed and which can be as good as your natural teeth and do not require any additional maintenance or any care or any added precaution. And they can be a blessing for someone who doesn't have teeth. Even if it's one or two teeth, they should be replaced with a dental implant. And with the advancement in technology in the quality of dental implants, the success rate with dental implants is almost 100%. It's an ideal way to replace missing teeth.
Thank you, ma'am. So next question is, it's about mouthwash, and there are multiple questions related to mouthwash, but I'll ask only one. Why should I use mouthwash, and should I use it regularly or often, like twice a week or thrice a week? Please advise.
Mouthwashes are basically antiseptic medications which we are using to rinse our mouth to reduce the number of bacteria, the oral bacteria. As for any antiseptic, it should be used in some limitation. It should not be used indefinitely. They do help, and they are necessary when you have some active oral infection, or a pre-operative medicament, like if you have to go for any dental treatment procedure. The pre-op requires a mouthwash. The post-op care to promote healing and any to prevent any post-op infection. Uh, the mouthwash is compulsory when you have gum diseases. But to use a mouthwash indefinitely might be slightly harmful. In per se, they can cause stains. Then there can be some resistance. So I would say that use a mouthwash whenever there is some gum infection, or you're going in for any dental treatment, or you have any upper respiratory tract infections, as during, we've been through the most difficult times, as during COVID. So the mouthwashes became a very essential. The antiviral mouthwashes like povidone, iodine, I've spoken earlier also about that. That can counter any viral infection, which is, can reduce the count of viruses in the throat and the mouth. So they do hold a lot of importance.
Thank you. And before moving to next question, I would request all the audience to please comment down their queries or questions so that we can take it from there. And if they have any query related to dental and oral hygiene. So next question is, ma'am, it's about at what age should we consider? Sorry, at what age should my child first see a dentist?
Uh, as soon as the child has teeth, a dentist role comes in, so that we can do preventive checkups. We can make sure that the milk teeth are healthy, because milk teeth are very important in terms of maintaining the child's nutrition, the comfort, and to allow the permanent teeth to come in a orderly fashion at the right time. They do act as a pathway for the permanent teeth to come into place. So, a child should be under a dentist's care as soon as the child has teeth. It's very important. It's very
Okay, so that was a very important question. Actually, I do have a child, so I'll make sure she should visit a doctor regularly.
Yeah, and we tend to ignore. It's very common, there is a mindset that we should visit a dentist only if we have a problem, and the milk teeth do not require any special care because they're going to be replaced with permanent teeth. But most of the people don't know that permanent teeth would come into the right place at the right time if the milk teeth are intact. And if the child is not having proper milk teeth, or is having some problem, then they tend to not eat well. They won't be able to chew their food well, which is very important during their growing years.
So, ma'am, there are multiple questions related to electric toothbrush and manual brushes. So, what are your opinions about electric toothbrush or manual brushes? Are electric toothbrush better than manual, or you can please advise, ma'am?
In simple way, what works good for you is good. But yes, the electric toothbrushes do have an edge over the manual ones, because we do have a controlled pressure that is applied on the teeth. Some people are, when they are in a hurry or as a matter of habit, tend to apply a lot of pressure during brushing, which can injure our gums, which can abrade our teeth, and in the long run end up having erosions in the teeth. The teeth become thin because there has been such vigorous horizontal brushing, which is not recommended. So in those cases, we would recommend using an electric toothbrush, because then you have a controlled movement, controlled pressure. The strokes are controlled. You don't have a vigorous or horizontal strokes. You can have a controlled circular motion of the bristles. So then in that case, electrical toothbrushes are advantageous and recommended.
Thank you. So, ma'am, and there are multi people who are like concerned with this problem of having a bad breath. So, can you please elaborate what causes bad breath and how to get rid of it?
Oh, I think we should have a separate session for bad breath. It's such a widespread problem and it's very common, and it can be because of numerous factors. Of course, most important is poor oral hygiene, lack of maintenance of hygiene, improper brushing, not timely brushing, uh, inappropriate use of any toothpaste, which is not good enough. These are the commonest problems, or not getting your regular teeth cleanings done. But it could be because of certain systemic conditions also, like indigestion, or some bad breaths can maybe related to diet, or a sedentary lifestyle, or certain medication. So there are certain conditions. Sometimes, there are certain medications which are used during respiratory treatment, which can cause some sort of bad breath, or um, they can there are certain conditions where our body's defense immune system is malfunctioning, and it reflects our gum on the gums, and our gums get infected, and then we have bad breath. Or there are numerous reasons, but yes, bottom line, we must maintain good hygiene, brush regularly, and if we have mouthwash, we should use mouthwash, and visit our dentist in such cases, so that appropriate treatment can be given. The commonest being the gum treatments that work well. And yeah, one more very important factor which is common when we don't brush our tongue regularly. Our tongue houses a lot of odor causing bacteria or germs and food debris. So if the tongue is not cleaned regularly, then also we have bad breath. So a tongue cleaner, or you use a toothbrush to clean your tongue, that helps a lot. That makes a difference.
Well, that was the very important point. Ki, like cleaning of your tongue is very important because most of the people like, as I said, they used to brush like this and then done.
Yes. Yes,
So
yes,
they don't
that's what
clean
I
tongue.
mentioned.
In fact, there should be a awareness about cleaning your tongue as well, related to in managing the oral hygiene. So, ma'am, next question is: my child's baby teeth have cavities, and should they be filled?
The milk teeth, right? That's what you asked. The milk teeth.
Yes,
Yes.
baby teeth.
Uh,
So,
Yes, I mentioned earlier also that the baby teeth, or the milk teeth, or deciduous dentition, what we call in our dental terms, is very important. That is actually that holds so much importance, that if the baby teeth are not taken care of, the permanent teeth are affected. The underlying permanent teeth can get infected. They may not erupt in the mouth on time. They may not come at the normal position if your baby teeth are not in place, or not there, or are infected. So it's very, very important to get the cavities or any problem related to the milk teeth treated. The treatment is very important, the timely treatment, and most importantly for the child's comfort.
okay. So moving on to next question now. Uh, this question which we have received from in our messages. It's I'm interested in changing the shape of my teeth. What options are available?
Okay. No, there are various ways you can change the shape of your teeth. Suppose if it's a broken tooth, a fractured tooth, depending upon the severity of the problem. If it's a tiny chip, we can repair with a tooth colored cosmetic.
Ma'am, seems we lost you.
Causing a break on the tooth, we can put a dental veneer, which is just a thin layer of material which is applied on the teeth, and it can correct the shape. And if it's a big fracture, or if it's a back teeth which requires a lot of strength, and or if it's an abnormally positioned teeth, the shape abnormal shape, we can correct it with the crowns, the ceramic crowns. So basically, the shape can be corrected with the help of veneers and the crowns.
Okay. So next question is, does diet play any role in dental health?
Yes, our overall well-being is influenced by taking a healthy, balanced diet. When we do not eat refined sugars and sticky foods, and that does make a difference. If we are having constantly sugary liquids or aerated beverages, that affects the enamel. The protective layer of the teeth is at is damaged regularly, and we are more prone to decay in our teeth. So diet plays a very important role.
Thank
The
you.
sugary drinks and the sweets.
So moving on to next question now, is root canal treatment is painful?
No, no. If it is done well, it is, and in case of a severe tooth, the root canal treatments are taken up in under local anesthesia, and they are not at all painful. And with lot of advancements and motorized instruments, it's very very comfortable and fast. The root canal treatments.
Okay, so there are few questions on braces as well. So I'll take very few. And first is, how do braces work and how long does it take to straighten teeth with braces?
Okay. Actually, the braces are used. This is part of orthodontic treatment, the medical terminology that we use. Orthodontic treatment or braces we are using to align our teeth in a normal manner when there are malaligned teeth or abnormally placed teeth or abnormally spaced teeth. In those cases, braces are used for correction. If have any problem with the aesthetics or the positioning of the teeth, we can correct it through braces.
Okay. So next question is, what are invisible braces and are they as good as steel braces?
Invisible braces, basically, these are kind of a refined plastic molds which are used to align the teeth. The function is similar to braces. When we are using wired braces, we are putting those conventional brackets on the teeth and aligning by applying pressure through the wire. We are actually changing or moving the teeth with some pressure, and these wires and brackets can sometimes be heavy on the teeth and cause gum injuries, or can abrade the cheek or the lip while biting, and they're very delicate. If you bite onto something very hard or something like nuts, they can break. Then if we have sticky food, it can get stuck between those wires. When we use invisible braces, all these disadvantages are overcome. We can eat anything, and they are little softer on the gums. The gum injuries, the abrasions on the cheek, all that factor is eliminated when we use invisible braces. And they have better compliance because the name says it all. They are invisible. When we use steel braces, there's a lot of metal showing on the front teeth, and when we use invisible braces, you don't have that metallic feeling, and it's very light on the in the mouth. So they are preferred. But there are certain very severe cases where we cannot tackle with the invisible braces alone, and then we it becomes important for us to use the wire technique, and we have to sometimes use a combination. So, though invisible braces are giving very good results, they are more receptive, but there are certain complex cases where we can say that we can't do without the steel braces. We still go back to the old school method.
Okay, so last question of this session is now, what is the right age for braces treatment?
The common and the most favorable age is the teenage. When we've got all the permanent teeth erupted in the mouth, which is between 13 to 14 years, and we can mold or direct the growth of the jaws. at the age of 13 to 14, the children are growing, and we can mold and redirect the age in the right, the growth of the jaws and the movement of the teeth in the right direction. So that is a very favorable age, and should be taken up that time with the dentist. But the alignment can be done at any age. When you have a healthy mouth and you want to align, whether it's you are 40 or 25, doesn't matter. The correction can be done at any age, especially with invisible braces. They're more we are treating patients with 45 years of age. There's no age bar. It's just that the younger the patient, then you can do it at a in a shorter time, you can say, and better results.
So thank you so much, ma'am. That was the last question, and we have learned a lot about taking care of our dental and oral hygiene from this session, and I'm very sure the audience to get good knowledge about the same. So thank you once again, all the audience, for joining us today, and thank you so much, ma'am, for sparing your time today and joining us and giving your sessions on us. Thank you.
Thank you. Thank you so much for having me. I wish to see you again, and let's spread awareness about the importance of dental hygiene. Thank you.